All right, and it's officially time here. Thank you all again for your patience and for joining us as we're here to talk about health careers and health degree programs at the University of Minnesota. My name is Laura Fife, and I work in the Pre-Health Student Resource Center at the University of Minnesota, and I'm one of the offices that supports pre-health students on campus. Oh boy. All right, so just a little bit about our agenda. We will be able to pick up those minutes at the end there. And so we're starting with just brief introductions, and we're going to make sure, let's see, there we are, that we're getting going with our program highlights. And then there will be time at the end for questions. I've got a few notes down there at the bottom that if you have a question, at the bottom of your Zoom window, you should see a Q&A feature, and you are able to submit questions using that Q&A. We may save a lot of those Q&As depending on how many are coming in. We may save them for the end, so we have time to answer them and be able to talk about them. And so for right now, feel free to put them in there, and we'll work on those as they come through. And then we'll be able to kick into our program highlights, hear from all of our wonderful guests that are here, and then be able to answer questions at the end. So I want to give you a very brief update on the office that I work in. My name is, again, Laura Fife, and I work in the Pre-Health Student Resource Center. We're a career center on campus, a specialized career center that works with students that are interested in health careers. And we have a number of ways that we support students really from anywhere on that journey of exploring health career options, preparing that well-rounded and competitive portfolio, and then getting ready to apply to the health degree programs. And that's what we're here to learn about today, is all of the wonderful health professional degree programs that are at the University of Minnesota. So we have a wide variety of support. We're here to answer questions, and we've got some ways to connect. We will be sending out some resources after this webinar, and so we can always follow up with you after the fact. And so I'm going to get right into our program highlights, and we are starting with our School of Dentistry. And I'm going to kick right into those slides. So again, thanks very much for being here.
Hi, everybody. We're going to go ahead and hear from Cecilia Lovinger, who is one of our wonderful dental students. And she's going to talk to you a little bit about the programs at the dental school. And I will let you know how to connect with our office at the end. Thank you.
Sounds great. Hi, everyone. Like Susie said, my name's Cecilia. I'm one of the students here at the dental school. And I'm excited to talk to you about all the different programs that we have, because we have 3 that are really interesting. I'll start with dental hygiene. So hygiene is about 1 year of prerequisites, and then it's 6 semesters in the program. And our hygiene students, if you have ever gone to a dental office and have a cleaning, or have maybe had some additional restorative work, they kind of specialize in that area of oral health and that cleaning area. They work with us all the time and really interact with all the programs. It's a great option, something that you can kind of consider doing kind of out of high school more. Our second program is dental therapy, and we have a really unique program at the University of Minnesota, because Minnesota was one of the first programs in dental therapy to actually have licensure. And it's kind of like an extended function. People have drawn similarities to PAs, if you've kind of heard of that, but in the dental field. So they're not going to 4 years for dental school, but it is 3 years of dental therapy school following some more college prerequisites, a little bit more than probably the hygiene program. But those students have opportunities to do expanded restorative functions. So they're doing fillings and really working right alongside us dental students in that program. And lots of really interesting opportunities there. They just are working in more underserved communities typically, and then under the licensure of a dentist. So that kind of brings me to the last program that we have at our school is the Doctor of Dental Surgery program. And it kind of highlights surgery at the end there because what I love about the dental program here is that dentistry is very hands-on. Every day we're doing lots of procedures. So we're doing fillings, different kinds of additional kind of deeper cleanings. We make dentures, we're doing oral surgery. So every day is different. There's always something new. And I think the beautiful thing about dentistry is that it's very broad and you're always learning new things. So if that sounds like something you'd be interested in, Susie will kind of cover more about how to learn about our programs. But the dental program is 4 years, and that's after completing typically a college degree. So there's also prereqs, so some people don't, but that's a pretty minority of people that don't get their actual degree before applying to dental school. Last thing I'll say is that beyond dental school, we do have some really interesting specialized fields. So typically if you're interested in orthodontics, if you've heard of that, or have ever had braces, if you've heard of root canals or oral surgery or pediatrics, it'd be getting your dental degree and then kind of going into those more specialized fields. So lots of opportunities, lots of careers here at the School of Dentistry, and we hope you take a look and consider them. Thank you so much.
All right, awesome. Thank you so much, Cecilia. We really appreciate you sharing more information about the programs at the dental school. So my name is Susie, and I am the Assistant Director in the Office of Admissions at the School of Dentistry. And so I'm here to share a little bit more with you all about ways that you can engage with us as prospective students to learn more about our programs and opportunities at the dental school. So I will actually start off with our Q&A sessions. And these are all hyperlinks that I believe that will be sent, this recording is going to be sent out. And if not, you can always reach out to the email at the bottom there. So that is our dbsapply@umn.edu email address. A number of people monitor that so we can have a quicker response. So if you have any questions about any of the programs tonight, you can always feel welcome to reach out. Our Q&A session stands for question and answer. They happen on a monthly basis, and it's a 1 hour, just kind of pop in, pop out with whatever questions you might have about dentistry, about the dental school, the programs that we have here. One of the admissions staff members will be there. They're normally hosted at night via Zoom, so they're accessible for people, and we'll be joined by one of our current dental students to help answer any questions. You can sign up for 1, you can then sign up for 5, so it's just a really great accessible way to kind of get questions answered in the moment. There's also on that link, there is a pre-recorded information session about the Doctor of Dental Surgery program. So just more in-depth information about the prerequisites that you would have to take and what makes a well-rounded and competitive applicant to the DDS program. And then there's also similar information sessions for dental hygiene and dental therapy combined. Besides that, we have an open house annually in June. There's one held for high schoolers and there's one for college students and recent graduates. It's normally roughly about a half of a day, and those are on 2 different days in June. So you just register for the relevant program to you. It's free for you to attend, and it's a great kind of low stakes, like one-time only way for you to get into the dental school, get a tour, get connected to students, and just get more information about the program. And, if you're thinking healthcare in general, why might you choose dentistry versus other healthcare careers? So besides the open house, we also have a couple of programs that are a little bit more intensive for students to be engaged in. So the first one at the top here is the Dental Hygiene Freshman Guarantee Program. So for those who will be coming to the University of Minnesota specifically for their undergraduate education, you can indicate that your major interest is in dental hygiene. Then you can be considered for the Dental Hygiene Freshman Guarantee Program. So that's an application process, and we had about 100 applications for about 10 spots. So it is competitive, but if you want to do a dental hygiene at University of Minnesota, please apply to that. And then the Discover Dental School Pathways Program is supposed to be primarily for Minnesota residents and from individuals who are maybe have experienced barriers to getting connected to the dental community and preparing for dental school. So more rural, first generation, lower socioeconomic status students, and it helps prepare you and connect you with resources to become a competitive applicant to dental school. That application is also on our website. It normally opens during January, and that is a free program for you to participate in. So I'd highly encourage anybody who is interested in that to apply during your first year, during undergrad, to start the program during your sophomore year. And again, there's another link for just more information. That's called our view book, and you can find that on our dentistry.umn.edu. Just want to reinforce that you can feel welcome to reach out with questions to ddsapply@umn.edu. I'll go ahead and pass it over to Madison.
Hello, everyone. My name is Needy Winham, and I am the Admissions and Recruitment Coordinator. I'm in the Office of Admissions for the University of Minnesota Medical School, and I'm located on the Twin Cities campus. Medical school. What is our mission? The University of Minnesota Medical School is one of the largest in the country, and we have 3 campuses. So our new motto is now we are one school, 3 campuses. We're based in the Twin Cities, on the Duluth campus, and now a newly St. Cloud campus, which will start matriculating in the fall of 2025. We're a world-class leader in medical education, research, patient care, and our mission revolves around providing innovative education and training, research that advances medicine and clinical care that improves the lives of our patients. So when we think about the University of Minnesota, we want students with a curious mind, a drive to know more, who are ready to practice medicine and devote their lives to service, care, research, leadership, and especially in our diversity of our communities. For those 4 years, medical students are going to be trained extensively in anatomy and physiology. And our students also learn professionalism, leadership skills, interact with patients. And one thing that this university does is gives you direct delivery of care before you graduate. So you will be connecting with patients right away. And a fun fact, that's we train approximately about 70% of all Minnesota physicians. So if you see a physician here in the state of Minnesota, 70% of those have been trained in one way or another here at the University of Minnesota. As you can see, our degree programs, our 4-year medical degree. We also have an MD PhD program for those who want a little bit more in clinical research and joining that scientific training along with medical education. And then you can also, we have a flexible MD program where you can combine a degree. You'll hear a little bit later about public health, but an additional year where you can add a degree in public health or biomedical engineering, a law degree or business or health informatics. So we give you a wide range of other degree programs where you can expand your medical knowledge. And I just want to say that we seat about 165 students on the Twin Cities campus every year. And then on the Duluth campus, it's 65 seats. And then St. Cloud, again, which will be starting next year, will be 24 seats. And so we have several students that apply, and those are our numbers that we seat our incoming class each year. Right now, we are currently in the process of getting ready to start our interview session that starts in September and will run until the spring. And that will be for our students who will be matriculating in the fall of 2025, while at the same time, we're engaging with our newly accepted students who will be starting in just a few weeks here, and their exciting orientation week and their white coat ceremony. So at this time, I'd like to tell you about how you can connect with us. As you see on the slide here, you can have all your questions come to medadmiss@umn.edu. You can also connect with us on our website. And then we have information sessions enlisted here on Tuesday, August 6th. Will be our next one at 10 a.m. and then Thursday, September 5th at 2:30 p.m. And in those information sessions, we go into much greater detail about our application process, about our interview process, a little bit more about the curriculum, what you'll go through in your 4 years during your medical school degree program. So feel free, it's open to the public. Make sure you connect with us at the website or send us an email and set up for those information sessions, and you can learn a lot more about the School of Medicine. So at this time, I'd like to turn it over to one of our admissions ambassadors, Bailey Jacoby, who is now in MS2. So she just completed her first year of medical school, and Bailey can tell you a lot more about her journey and her experience as a medical school student at the University of Minnesota.
Yes, hi everybody. Like she said, my name is Bailey Jacoby. I am going to be starting as an MS2 roughly a few weeks. So yeah, I'm currently following the MD program. But I guess I can kind of give a little bit of background on what that program has looked like so far. So we are a brand new curriculum as of this past year. And we've been following a block schedule, such as we do like a cardio block followed by, renal or however. And during our training, not only do we have our lectures, we have in-person and asynchronous ones, but we also, as was already mentioned, have a lot of clinical experience already, whether that be through, we have a class called our early clinical experience, where you get one inpatient and one outpatient setting. And in those, you get to go in and start applying what you already know. So it started very soon in the fall. So with that, we were able to start practicing our physical exams, gathering our HPIs, and actually interacting one-on-one with our patients right at the beginning of our school year. We also have, along with our lectures, you have an anatomy program. And we are a donor program, so we do get to practice that in person, which has been really lovely so far. And then another, I guess, highlight of what my medical school career has looked like so far, and something that I think the U has really had a strength, or is a strength of the University of Minnesota, is that we are connected to a lot of hospitals in the Twin Cities between both Minneapolis and St. Paul. And with those, all of those physicians want to teach, want you to be there, and are just really fantastic about getting you where you want to be. So whether that be in the OR, whether that be in clinic, they are very good about having students come in, learn from them, start practicing their skills, whether that be, I've had chances to scrub in the OR, I've had chances to work with patients in clinic settings, and just overall, this is where I'm at in my medical school career. We'll be starting rotation soon, but that's kind of the gist of what it looks like at the very beginning. So I'm looking forward to answering any questions later. But yeah, that's our program.
Thank you, Bailey. And now we'll turn it over to the School of Nursing. Thank you.
Hi there, my name is Reagan. I am a rising sophomore within the BSN program here at the Twin Cities. I also work within this nursing school in a few different roles as a peer mentor, liaison for the admissions and advising offices, and as a tour guide. So just to start off, I want to highlight some of our short history. As the first campus-based nursing school in the United States, we were founded in 1909, largely by Dr. Richard Oldenbeard, who was a current professor of physiology at the U, that really recognized the value of nursing and believed in the advancement of professional education for women. So we're really proud of that history and how we've adapted since then. As of now, we do have a few different types of programs at both undergraduate and graduate levels. Our freshman BSN students are admitted directly into the nursing school, and that's a really great thing to highlight, as a lot of other schools may have a 2-year prerequisite and then application in. You start with us from day one. And that would be located in the Twin Cities with an application due November 1st for priority. And that process is going to be more through the undergraduate admissions office. So if you do have questions for that, we recommend going to the admissions.tc.umn.edu website and contacting them there. We do want to make sure you know that personal statements and SAT and ACTs are going to be optional this year, though our nursing supplemental essay questions will be required. For the BSN, we also do have a transfer pathway, and that's going to be located on our Rochester campus. You can complete 6 prerequisites 1 year at a community college, university, or another location, and then start with us your 2nd year. And that'll be a 3-year program with us in Rochester. In the past few years, we are really proud to have 100% acceptance rate for that transfer program. So definitely recommend looking into that if that's something you're interested in. That admissions will be through the Nursing Advisory Office. It's called OSCAS, OSCAS, and you can reach that through nursing.umn.edu if you have any questions. And we do want to highlight with both of those programs our peer mentorship program, which is in place for all first year and second year transfer students. Through Nursing Seminar, which is a year-long course for freshmen taught by the Dean of the School of Nursing as well as an academic advisor. And through this program, you're put into small groups led by a sophomore nursing student to meet once a week in mentorships in order to talk about various topics ranging from different nursing specialties and finding your footing in nursing to nursing ethics and work-life balance, as well as exploring diversity, equity, and inclusion at the U and beyond. So that's a really great program to meet people and to get started and get your feet started into the nursing program. We also want to highlight in later years our skills lab in the Benson Center, which is a state-of-the-art 11,000 square foot skills center consisting of mannequins capable of responding to stimuli and working with students to practice skills like IVs and catheters, as well as our clinicals in junior and senior year, similar to what the medical school was talking about, where you rotate through various nursing professions from psychiatry to public health to med-surg to obstetrics, and everything in between, in a hospital setting or clinic setting with real professionals and real patients. We also, again, have our graduate programs, like our Master of Nursing program, which is available to individuals who graduate a bachelor's program and have that bachelor's degree in a non-nursing field, and then are hoping to get into nursing. And that's just a short 16-month in-person program, including that summer semester, where you're working with clinicals and in-person classes to get those entry-level nursing skills that allow you to graduate with your graduate level master's degree, as well as your RN license after the NCLEX exam. We also have a Doctor of Nursing Practice and a PhD program within our school. Our Doctor of Nursing Practice is 1 to 2 years for postgraduate level students and 3 to 4 years for post-bachelor students. Both are wonderful opportunities available to everyone around the United States. We help with relocation and finding jobs, whether you are going to be working in Minnesota afterwards or in your home state. We do guarantee that assistance. We also have 12 different specialty areas in that program to look into. You can find info on all 12 on our website, nursing.umn.edu, but we have specialty areas ranging from psychiatric and mental health nurse practitioner to a general adult gerontological nurse practitioner and everything in between. We also have a certified nurse anesthetist program, which has a slightly different admissions process, but we have a lot of information on that on our website if that's something that interests you. We also want to let you know that our PhD program, again, can be in person or virtual. That's going to be completed in about 4 to 5 years, depending on the student. And all of these graduate programs come with automatic scholarship and financial aid consideration. It doesn't require any additional application. It's all right when you apply. So we're happy to work with you if you need additional financial assistance. Lastly, some stats that we want to highlight. We do want to highlight our NCLEX pass exam rate, which currently is at 91%. It's higher than the national average of 89%. So that's something really special about our school. We really prepare you for the NCLEX. Starting at the end of your junior year, we'll prepare you with what questions may look like. And then senior year, you do work on practice exams and all of that preparation work. We also want to highlight our 92% BSN student graduation rate. And the on time there is just letting you know that 4-year typical pathway. We really like to work with our students to make sure they get in and out in the timely manner, which typically is those 4 years. If you need additional time, we're always helpful in working with you on that, but typically our students do graduate in those 4 years. Additionally, our large campus opportunities are enhanced with the small cohort-based support. Our BSN programs in particular typically have about 100 kids in them. So you have a really small cohort, and then even smaller within your peer mentorship where you're working with 10 to 12 students. And that creates a really great atmosphere where you know everyone's name by the end of your 4 years, while also still getting that Big Ten large campus feel, being at the U as a whole. So those are some of our really special highlights with the nursing school. If you do have any questions, you can always reach out to us at sonstudentinfo@umn.edu, or you can go on our website, find contact info there as well. Or you can leave any questions in the Q&A box. I'm happy to answer them at the end of our session. As of now, I'll be passing it on over to Medical Laboratory Sciences.
Thank you. And hi, everybody. My name is Sherry. I am the Admissions and Recruitment Coordinator for Medical Lab Sciences. This is one of 3 programs housed under the College of Pharmacy. And I'm just going to say a few things, and then I'll pass it over to our student ambassador, our student presenter here. But if you like lab sciences, if you like solving problems and puzzles and analyzing information, and you're interested in a career in the healthcare industry, medical lab sciences might be something to take a look at. And if you've not heard much about it, I definitely encourage you to check it out and learn more about it. It is a program, primarily our program is undergraduate. We do have a very small master's program and a certificate program, which you could complete after your if you do an undergraduate in a different major. But most students go the route of doing this program as an undergraduate. Currently, you can start as early as your 2nd year in the program, or your 2nd year at a university. So right now, we're not freshman admitting. We hope that someday in the future we will be. But right now, you would need to complete Chem 1, Chem 2, and one other class in order to be eligible to apply to medical lab science major. And if you come in as a sophomore, you will really have, plenty of time with us. The last semester in the program, you're going to be doing clinicals, and Sophie could tell you a little bit more about that. But we also do have great scholarships for undergraduate students. So we have, if you qualify, we have a government-funded pathway scholarship for students who are low-income, first-generation, or underrepresented in healthcare fields. And that can depend on where you live, where you went to high school. So yeah, a lot of different career outcomes, and it is great preparation for a lot of professional programs in healthcare. And I would just encourage you to visit our website. But yeah, I'll turn it over to Sophie Levakin.
Hi, thank you for the introduction, Sherry. So like Sherry just said, my name is Sophie Lebakken, and I'm currently a 4th-year student in the MLS program. And so far, I've completed my freshman year and sophomore year. And I actually was not in medical laboratory science until, like Sherry said, I was admitted as a sophomore. So prior to my junior year, I was taking normal college classes, and a lot of them were the same prereqs as pre-meds. So medical laboratory science is a really great avenue for medical school. But I just wanted to kind of touch on some of the basics of MLS. I think solving puzzles, problems, and sometimes math as well. If you are good at those basic tasks, I think medical laboratory science would be a great major for you. And something that is really great about MLS is that if you would like to work in the medical field or healthcare, but you're not really interested in working with patients, this is a really great career option because you'll really only be interacting with patients when drawing blood and reporting patient results. So that's something to really consider. But in terms of like career roles for MLS, they can work in a normal clinical lab, so a hospital lab. They can work in transfusion medicine, public health, government, industry, and education. So there are endless career options, which is really great. And within these career options, you also have additional options to choose which discipline of medical laboratory science you're most interested in. So there are currently 7 disciplines for medical laboratory science, and they are microbiology, chemistry, hematology, immunology, transfusion medicine, toxicology, and molecular diagnostics. So you can really fit in into any aspect of MLS, which is really cool. Yeah, I think MLS is really great for preparing you for medical school, dental school, veterinary school, or just research. I currently work in a research lab, and I have noticed that my program has prepared me so well for my research job. And I've learned so much from just my first 2 classes in the MLS program. So I'm currently entering my 4th year, and that's when I'll be fully submerged in all of my MLS classes. And then once I finish my year 4, I'll be headed to my clinicals. And after that, I'll take a board of certification exam to become a certified MLS. So that's very exciting, but it's going to be a ways away for me. But yeah, I think MLS is a great career option for anyone that's interested in the medical field or simply just labs. I think it's a really, really great program. And then something I also wanted to touch on is how small our class sizes are. So currently in my cohort, I want to say there's between 25 and 30 of us. And there were countless times during my Fundamentals of Biomedical Laboratory Techniques class that we had 4 professors constantly circulating the classroom, always answering our questions. It took less than 30 seconds anytime I had a question for it to be answered. So we're super close with our professors. We're on a first name basis, which I love. They're super great and always understanding. So I love everything about this program. I could talk about it forever, but I think we are going to pass it off to, let's see, occupational therapy.
Yes, hi, I'm Diane Anderson. I'm one of the faculty in the occupational therapy program, and I'm also the admissions chair, and I work very closely with Sherry Beck, who you just heard about with pharmacy. Both MLS and occupational therapy have recently moved into the College of Pharmacy, so we are in the process of being integrated into that college. So occupational therapists, we are not a career that people hear about as little kids and say, hey, I want to be an OT when I grow up. You hear about it because a family member, a friend comes to need an occupational therapist. So we help people of all ages and abilities do their everyday things, the things that they need and want to do in whatever context they want to do them. So you're going to find OTs in settings that range from a neonatal intensive care unit to with the very fragile newborn babies, all the way to a skilled nursing facility with end-of-life issues, hospice, that kind of thing. You'll find us in prisons and in schools. Those are not the same thing. You'll find them in industry. You will find us in many and varied community settings. So anywhere where people are challenged by physical, emotional, social, spiritual, or environmental barriers, you can find an occupational therapist. We are a 3-year professional graduate program. You will leave the program with an occupational therapy doctorate. That's a practice level doctorate. We we're one program admitting on 2 different campuses. So we have up to 27 seats in our Twin Cities campus and up to 22 seats in our Rochester campus. You get to select the campus that you want to be on, and depending on how many students we have applying, you'll get the campus that you would like to do. We're already admitting for fall of 2025 through our early admission process. So you can find, if you're interested in OT and you're ready to go, you can already do that application. We also have 3 early assurance programs. We have one with the University of Minnesota with their health sciences track. We have one with the University of Minnesota Rochester through their Bachelor of Science in Health Sciences degree. And we have one with the kinesiology major at the University of Minnesota Twin Cities campus. Again, we are one campus, one program, 2 campuses. I do encourage you to click on those 2 links if what I've said is a little bit intriguing and you want to find out more about OT. Again, we are not a profession that people hear much about until you actually need an occupational therapist. I do want to mention some ways you can get some information. First, we have a preview day coming up on Saturday, October 26th, and that's going to be on the Rochester campus. And I will be down there at Rochester along with our site coordinator. We also have monthly occupational therapy information sessions. Those are online. You'll see a link at the bottom of the page. You can go on to that link and you can register to come to an OT information session. And then we also do monthly campus tours on both the Rochester and the Twin Cities campuses. And at that time, we typically have one of our student ambassadors there to answer your questions from a student perspective. And either I'm on the Twin Cities campus or I get another faculty to represent the program there. And Hannah Oldenburg, Dr. Oldenburg is down on our Rochester campus to meet with students down there. And I am turning things over to one of our wonderful student ambassadors. We have 4 student ambassadors. And Liliana Schenk is a student ambassador down in the Rochester campus, and she's going to talk about her experience.
Hi, I'm Lily. I'm an OT ambassador for the university and the program, and also a second-year OT student at the Rochester campus. So I chose the University of Minnesota program because it was the only public program that offered the hybrid format, which is something that I was attracted to due to like the flexibility of having that balanced life between like my personal interests and schoolwork. Through this, I'm like able to experience like less burnout than a lot of my other peers who might be in a program that meets full-time in person. And this hybrid program like also allows me to be in a better financial position as a graduate student and work part-time, which is pretty uncommon. So when we are in person, we do have like a small professor to student ratio, allowing for that better like connection and relationship. Also for further like in-depth learning. And then if you want to like know more information about that, like face-to-face, you can follow our Instagram actually at UMN_OTD. This has like more content relating to what you'd be learning during those in-person weeks. And then also just to highlight, I've been able to experience level 1 fieldwork experience every semester so far. So I've already been placed in a mental health setting as well as an older adult setting where I've been able to just like further my learning I've learned in class, such as like documentation, learning the appropriate assessments, and learning how to implement proper OT interventions. And then after all of my level 1 fieldwork experiences, I'll go on to 2 additional level 2 fieldwork experiences and then complete my capstone project. And then just kind of wrapping it up, I have aspirations to work within the pediatric community and long-term goals to work in a children's hospital, which is something I feel I'll be able to pursue quite easily just due to the community outreach and professional relationship this program provides students.
We have just a minute. I do want to pick up on something Lily was talking about, and that is that we are a hybrid program, which means that about 75% of our coursework is done online through the Canvas learning management system. You will do that on your own. Each module within each course has some kind of assessment that you will actively participate in. You come to campus for 2 days every other week. You do not come to campus for lecture. You come to campus to apply the information that you've been learning on your own. So to be in our program, you need to be highly motivated and you need to be able to work independently. And again, you are placed on 4 level 1 field work. So those are 40 hours each to get face-to-face experience, and 2 level 2 field work experiences each for 12 weeks, where you get you leave with entry-level skills as an occupational therapist, and then you complete your capstone to get your occupational therapy doctorate degree. And now we'll turn it over to College of Pharmacy.
Perfect. Hi, everybody. My name is Caitlin Nygaard. You probably noticed on the previous couple of slides that OT and MLS are also under the College of Pharmacy. So you saw that on their slide, but I'm talking about pharmacy in regard to our Doctor of Pharmacy. So, all right. So our PharmD program here in the College of Pharmacy educates students to become the medication expert on the healthcare team. We require a list of prerequisite courses to be completed before you start the PharmD program, which does typically take about 2 to 4 years. It depends on if you're going to do a bachelor's degree or not. We don't require students to come in with a bachelor's, so sometimes a student will just do prerequisites. Sometimes high school students will get a lot of these done through high school if they're doing AP or PSCO credits, things like that. So keep that in mind. If you're thinking pharmacy, you can definitely get some of those prereqs done in high school if you wanted. We do offer early assurance programs on the Duluth campus, Morris campus, Crookston, or Rochester campus. So you can be conditionally admitted to our PharmD program if you're starting at one of those campuses for undergrad. And then we do offer an accelerated 3+4 program where you would get your bachelor's degree in biomedical sciences and your PharmD at UMD in a umbrella of 7 years versus a traditional 8. So again, you'd have to be going to UMD, which is the University of Minnesota Duluth, to do your undergraduate degree and then choose to do your PharmD program there. So once your prerequisites are almost complete, that's typically when you'll start applying for the PharmD program. And then you will have the choice to attend the PharmD program on our Twin Cities or Duluth campus. Like I said, the only exception where you'd have to choose Duluth campus is if you are doing that, like one of the 3+4 program. If you do early assurance, you can eventually choose which campus for PharmD. But if you're doing the accelerated 3+4 in Duluth, you'd have to go and do your PharmD there as well. There are a lot of different career areas in pharmacy. The list that I have on this slide here is super short, but I encourage you to visit Pharmacy is Right for Me and our Minnesota Pharmacy Career Exploration Center to learn more about different areas. This QR code will bring you right to a platform where you can rabbit hole very quickly into different areas of pharmacy that might be interesting to you. And we do have a student here as well, and she will talk a little bit more about what her area of pharmacy interest is and kind of how she got to where she is. But at the bottom of the slide, just to kind of close up my section, you're welcome to contact us at any time if you do have additional questions. Pharmacy@umn.edu is a great place to get in touch with us. So I'm going to pass it over to our current student, Ashley, and she'll be able to share a little bit more of her perspective and career interests in pharmacy.
Thanks, Caitlin. So my name is Ashley. I'll be an incoming second-year pharmacy student on the Twin Cities campus this year. So I kind of want to start with how I got into pharmacy while I was in high school. So this is very untraditional, but I had exposure to like an internship during high school kind of thing, and I got into a hospital pharmacy. And I did like random projects for the directors, and that really kind of solidified pharmacy for me. I knew I wanted to do healthcare, but I kind of wanted more of a behind the scenes approach, something that wasn't so direct patient care, like a nurse or a doctor. And there definitely are those opportunities in pharmacy, but I kind of wanted something a little more hands off. So that was my first exposure into pharmacy. And then just throughout college, I also had a lot of experience. I work in a retail pharmacy now. I was in the pre-pharmacy club. And so I would say my number one recommendation is just to get your foot in the door, whether that's shadowing as a high school student, or if you can get any work opportunities, I would really recommend that. Those are like my biggest pieces of advice. In high school, I also took like AP classes. I was really interested in math and science, so that kind of led me to healthcare as well. And also the AP classes I took kind of got me ahead into pharmacy school, so I'd really recommend that. So like I said, I have retail experience personally, I have hospital experience. I'm also doing a summer internship right now with Fairview, where it's a leadership internship actually. So I work with a lot of directors, which is very untraditional. You don't really get that experience much, but the College of Pharmacy really set me up for success in getting that internship. And like Caitlin said, there's so many opportunities in pharmacy. I want to emphasize it's not just counting pills at a Walgreens. There is like so many. I know when I'm shadowing older pharmacists, they're like, the fact that pharmacy has grown this much in this amount of time, I can only imagine what will happen when you graduate. So if there's really so many opportunities in pharmacy, I just want to really emphasize that. And then just how I kind of got into the University of Minnesota. So I went to undergrad here in the Twin Cities, and I was a part of the pre-pharmacy club and had really great connections with people like Caitlin and Cassie, who's on the Twin Cities campus. And they're really always open to talk and went the extra length for the pre-pharmacy club. So those are great connections that I made, and they also set up opportunities with current pharmacy students, and that also really helped solidify pharmacy for me. And then when it came to time to apply, I applied to 2 other schools, and it was just very apparent in my interviews that University of Minnesota really liked making connections and believed you were more than just like another number to their cohort. They really cared about you, and I like still remember the professors who interviewed me, and that kind of just really stood out to me. And I got to stay where I live, so that was really great. That's more about me. I'll stay around for the Q&A session. I don't know if Caitlin, if you have anything else you want to add.
Yeah, I'll just put a quick little plug in here. You mentioned that you were involved with the pre-pharmacy club on the Twin Cities campus, which is just a piece of advice that I have for students, regardless of which healthcare path you're interested in. A really great question to ask when you're touring different schools is to ask if they have a pre-health club or a pre-pharmacy club or pre-dentistry or pre-whatever it is you're interested in, because those are really great organizations to be a part of, to learn about the different areas in that profession, and then get connected with current students and professionals and just networking. So that's a great question that you can ask kind of in your journey now. The Twin Cities, as we've kind of mentioned now, has a great pre-pharmacy club, but I'm based in Duluth. I didn't mention that at the beginning of this, but I'm based on our Duluth Pharmacy School. And we have a really good pre-pharm club here as well. So just wanted to plug that in. But yeah, I don't really have any other things, but we'll be here for the Q&A if you have additional questions, and we'll pass it over. I think it's physical therapy after us. So thank you, everybody.
Hello, everybody. My name is Mark Fierst. I'm the admissions coordinator for the Division of Physical Therapy. We are in a position kind of like OT where unless you've gone to PT or someone you know or someone you love has gone to PT, you might not know what we do. And so very simply, physical therapists are movement experts. They diagnose and treat movement problems. And I guess it's not a great thing, but the great thing about PT, about being a movement expert, is everybody moves. And pretty much everyone at some point is going to have a broken bone, a torn ligament, a sore back, a sore neck, a sore shoulder. And so it kind of goes well beyond, it kind of goes into all areas of life, like the occupational therapy. And so I know that, many of you that are joining us tonight know exactly what you want to do. Some of you might have no clue. You want to do something in the health career, health field, but haven't quite decided what you want to do. And so I'm just going to ask a question to our student panelist, our Doctor of Physical Therapy student, Claire Nash, why she chose PT, to give you all kind of some insight into the profession.
Yeah, thank you, Mark. Hi, everyone. My name is Claire. I am a 3rd-year student at the U of M, so I am in my last year of the program. I chose to go into PT for a lot of reasons. The main one was in high school, I knew I wanted to go into healthcare, and I knew I wanted to be hands-on with patients. And the best part about PT is that we get to be with patients for the longest out of a majority of their healthcare team. We get to see them throughout a huge portion of their rehab journey and get to be hands-on and interact with them a lot in order to get them back on their feet and get them back to what they love to do. I I love patient interactions. I like being involved and getting to know my patients, and that has been the best part about the field so far. So that is why I picked it.
Thanks, Claire. So the work environment, that's what we have. Our next bullet point talks about the different ages. You're working with patients of all ages, a variety of health related conditions, and a variety of specialty settings. I'm not a PT. Claire, you're almost there. Can you just talk a little bit about the different types of jobs that are out there within the PT profession?
Yeah, we have pretty much anything you could think of. So the most basic one most people think of is outpatient orthopedics. So working on hip replacements, knee replacements, injuries like a torn ligament or a strained muscle. But there's so many more options. You work in hospitals. We can work for sports teams. You can work in geriatrics with older adults, with kids in schools, which was a new thing I learned about this year. We work in neuro, so people who had a stroke or people who had a heart attack, we work on rehabbing them afterwards. Um, pretty much anywhere. Um, yeah.
Yeah. And so you'd actually just talked about the three areas of the pictures that we have here. The first one in the top is actually our students in our sportsy club or sportsy group. Those are students that are interested in going into sports orthopedics. They are in that picture actually doing preseason shoulder assessments with the University of Minnesota softball team. So that's one area that they can work in. You see the picture right below that. That's one of our simulated labs with the students doing practice in acute care, so hospital. And I had actually first, well, it wasn't me, but my mom had a stroke last year, and so I mean, I remember sitting there and visiting her, and the PT would come in and ask her to do certain things. As far as movement to make sure that's going well. So you can work in a hospital. And then the other picture there is one of our faculty members, Dr. Brian Ishola, who actually has his own private practice. And so he works for himself, which is really nice. But he is, working with an athlete, getting that athlete back to performance. And so that really kind of covers, again, a lot of the different types of jobs, the work environments. And so it really touches all different aspects of healthcare. So the Doctor of Physical Therapy, the DPT program itself, it is a doctorate program. So when you graduate, you have that doctor in front of your name. One of the great things about our program is that with our faculty, they're very down to earth. They want to get to know you. They are kind of that non-professory, professor-ish people that demand that you call them by their first name. And so that's one of the great things about physical therapy, and Claire kind of touched on that, is that they get to work with people. They're very hands-on. They are working with patients from sometimes the lowest point of their life through a debilitating injury, a car accident, the senior who has lost, his or her senior season to a ligament tear, and they get to work with them all the way through. So there is a lot of interaction, and for the most part, the physical therapists are kind of people. Claire did mention that she is in the third year of the program, the third of 3 years. All programs need to be accredited by CAPTE, which is just kind of the accreditation body for physical therapy programs. We are a 3-year program, 9 semesters. So we go in the summer. Some programs will finish in 2.5 years. Those that finish in 2.5 typically have fewer breaks. And Claire can probably attest that having those 2-3 week breaks in between semesters is really nice. And then you have your state licensure exam that you need to pass. And so Claire just got her book to start studying for the boards, I think yesterday. But I don't know if you wanted to talk even a little bit more about, your experience within the program.
Yeah. So like Mark said, our professors are incredible. They are so hands-on. They really care about us and how we do in the program. They care about us succeeding and just learning and being comfortable and competent stepping out into the field and being hands-on with patients. Our cohort size is 62 is how big my class is. And I still get a chance to talk to professors one-on-one multiple times a class session. We have incredible lab assistants who are practicing PTs in the field, come in for our labs, and they share their wisdom with us, and they share tips and tricks for studying for exams, learning a technique. And it has just been such an incredible opportunity to learn from all these incredible faculty members. My class itself is filled with some of the best people I've ever met. Everyone is very like-minded. We all have the same passion, and it just leads to such great conversation and camaraderie. I could sit down next to anyone in my cohort and be able to have a conversation and just be comfortable learning and working with them. It has been wonderful.
Thanks, Claire. So there's a couple links there to APTA, which you can learn more about physical therapy. The link for UMN DPT, you can learn more specifically about the program at the University of Minnesota. And then you also have the Instagram. We're not on TikTok, but if there's time at the end, Claire will do a TikTok dance at the end of the Q&A. But if you are on Instagram, you can follow us and learn more about kind of what Claire was talking about, what it's like within our program, what the students are doing on a daily basis, what our faculty are doing on a daily basis. I did put this on there, did want to point out that last year's survey or ranking, U.S. News and World Report listed physical therapy as the 3rd best job in healthcare and the 6th best job overall. So that's a really good reason why to go into PT. If you have questions, you can email me at the UMN PT admissions. If you have questions for Claire, you could email her. Is that okay if I put your email in there, Claire? So you can email Claire if you have any questions about the student perspective. That is it. I am going to, if you have questions, let us know. Otherwise, I am going to turn it over to public health.
Thanks, Mark. Good evening, everybody. Again, my name is Dan Chang. I am the Director of Student Recruitment for the School of Public Health here at the University of Minnesota. Like kind of some of the sentiments that were shared earlier, public health is one of those programs that isn't one that everybody was talked about or had talked about as a young child or anything like that. Somebody wants to study the tick-borne illnesses or anything like that. It's probably not something that initially comes to mind as a kid, but I do want to take a little bit of time to tell you more specifically about what public health is. We're having a little bit of technical problems, so hoping that our student, Megan, will be able to join us. If not, hopefully she'll get to us in the Q&A. Otherwise, we can follow up with some information after the presentation. But essentially, from overpopulation to climate change, emerging infectious diseases to foodborne illness, the world faces tremendous health challenges now and in the future. Public health addresses those grand challenges head on, finding ways to deliver clean water, make healthcare affordable, stop infectious disease before an epidemic begins, and create more livable cities. So the public health are one of the great reasons what I love about having these types of events where bringing all the different health professions together is that public health is often linked to other health sciences. And though all health sciences are essential and complementary of each other, public health stands apart in 3 key ways. One is prevention. Public health stops suffering before it starts. Population. Public health seeks solutions for entire communities rather than treating disease and injury one patient at a time. and partnerships. Public health research is built on partnerships to explore the root causes of and the solutions to persistent or emerging health and policy challenges. With our partners, we also move our research into action. So I wanted to give you some examples of urgency in public health currently. The world is changing fast, and the School of Public Health is at the forefront of efforts focused on ensuring good health and well-being for all people, especially underserved and underrepresented populations. So some examples here: rapid population growth. The world's population will swell to a projected 8.5 million people in 2030, the year 2030. That's 1.2 billion more than today, making it ever more costly and overwhelming to treat health issues after they develop. So the key is prevention, so we don't have to deal with it in these large populations after an emergency happens. Also looking at unprecedented rates of an aging society. In 1950, the population of people 0 to 4 years was nearly double that of people 65 and older. And so by 2050, that statistic will actually be flipped, creating more urgency to find ways for people to age in healthier and more dignified ways. Our global economy is producing more diverse communities with broader health needs, and ease of transportation is increasing the spread of diseases. So we have so many different transportation options, and being able to travel globally a lot faster than we used to decades ago. And so that contributes to the spread of diseases. So not all bad things, but we're thinking about the prevention. So we want to still be able to do all those great things, but we also want to prevent that transmission of disease as we are becoming more global. Also, a warming climate is causing oceans to rise, forcing people to live in more densely populated areas. And this is creating more opportunities for emerging infectious diseases. So as we're closer together and densely populated, as people are easily spreading disease amongst each other, those diseases, viruses mutate a lot quicker. And so you're finding that becoming more and more of a problem. So on the screen here, you'll see a couple photos. I like to remind public health is in all different kinds of areas of study and professional opportunities. So if you like labs, you can work in a lab doing research in public health. If you like to collaborate with people, you might be in a boardroom collaborating with people across healthcare units and systems. It's also boots on the ground. A picture here, you see somebody that's packing boxes of health supplies that they're going to be sending off to emergency crisis centers. Down here in the corner, again, going back to the tick-borne illness, you have one of our faculty members and students actually out in the woods, in the field, gathering ticks to study them, the spread, what diseases they have, how the numbers that they're coming in certain times of seasons. So if you really like the outdoors and being part of nature, environmental health is a big part of public health. In the middle here, you see a picture of legislation. Public health is also in government. So we really help provide critical information and research and best practices to government officials to help build better bills and legislation and policies to enforce or protect communities through the legal route. Also here you see some fresh produce. Nutrition is another example of important public health knowledge and growth. So I'm actually being told that Megan might be here, so which is great. So this is a great segue because Megan is one of our public health nutrition students. So I will actually send it over to Megan here shortly as soon as she's ready. But while she's getting on, I do want to point out there's a QR code here to learn more. So if you are interested in learning more about our various programs, we have a bachelor's program, but otherwise we have a majority graduate and professional degree program. So after your bachelor's degree, you can scan that code. There's just a small form there, and I'll send you some follow-up information. So Megan, if you're in, I'll hand it over to you.
Yes, can you guys hear me okay?
We
And
can
see me? I can't see mine. See me okay? Okay, I had some technical issues, so I apologize for the delay. But yeah, like Dan said, I am just finishing up my first year of the public health nutrition program at the University of Minnesota and just starting my second year this fall. Crazy how fast it flew by. So I'm just excited to be here today because I can share a little bit about my journey and how I found my passion for public health nutrition. So just a little bit of a background. I am a Minnesota native. I grew up in Stillwater, Minnesota, which is about 30 minutes east of the Twin Cities. So to kind of how I got into the field of nutrition or how I found that would be an interest of mine. In high school, I was heavily involved in sports and was an endurance athlete, which made nutrition a vital part of my life from an early age. So my inspiration to pursue nutrition came from a registered dietitian I actually met at high school. So her guidance had a significant impact on my sports performance, and I realized I wanted to help others in the same way she helped me. And this led me to research colleges that had a strong nutrition program. And so this ultimately resulted in me finding Iowa State University, where I ended up attending for my undergrad. And after touring campus and just learning about their program, I knew it was the right fit for me. And I graduated in May of 2023 with a Bachelor of Science in Dietetics. But after that, I realized I wanted to go more of the public health setting. And I just wanted to focus on public health that impacted larger communities and populations rather than just giving that individualized care. So public health nutrition caught my attention just because of its broad impact on community health. And I chose the coordinated program at the University of Minnesota because it combines a Master of Public Health in public health nutrition, which has the coursework and 100 or 1,000 internship hours to become a registered dietitian. So to kind of give a little bit of a background, in order to be a RD, a registered dietitian, it's required for you to have your master's degree. So since I knew I wanted to get my master's in public health, I started looking into programs across the country that offered both the Master's of Public Health and the Master's in Dietetics. And so University of Minnesota is one of the very few programs out there that actually offers this coordinated program. So yeah, and just kind of how this relates, just consider how nutrition education can prevent chronic diseases like diabetes and heart disease. So by promoting healthy eating habits and ensuring access to nutritious foods, public health nutrition can improve overall community health and reduce healthcare costs. So ultimately, I would encourage all of you just to explore your interests and seek guidance from whether that's academic advisors, teachers, family friends, just to kind of see what you're interested in. And just because my path became clear when I met with a registered dietitian in high school, and I hope you guys all find a similar inspiration and support in your journey.
Awesome. Thank you, Megan. I'm glad you're able to make it on and share that experience with us. And so we will pass it on to veterinary medicine. Thank you.
Thank you, Dan. Thanks everyone for hanging in here this evening as we reach the end of the alphabet, or just about the end, with veterinary medicine. And again, my name is Karen Nelson. I'm the Director of Admissions for the DVM program. And I'm here with Sid, who is a second-year student who we will talk to in just a little bit. But to get started, I wanted to talk briefly about the profession of veterinary medicine. Many folks have very specific ideas of what veterinary medicine might be about, but it's a very broad profession that spans many different species and many areas of science and interest and in health. So, of course, veterinarians treat animals. They are responsible for all animal species, and they are licensed to treat all species. So whether they're interested in dogs and cats, they need to know a little bit about, wildlife or production animals, farm animals, for example, or horses. So it's a broad area of knowledge that they are responsible for. They are also really instrumental in public health. So I always like when we follow the public health folks. It's a nice tie in there. Humans and animals have a lot of different intersections in life. Dan mentioned ticks, for example. So veterinarians are involved in public health, and they are studying animal populations and how diseases in animals, zoonotic diseases, might be transferred to humans by way of a tick, for example, or some other sort of vector there. And they are involved in disasteredness and response. So if there's a natural disaster and we have things to worry about, like animals within those areas, veterinarians are involved. And also in food safety and food production. So if you're, for example, going to be a producer and you're going to sell milk or eggs, for example, to a larger company, the transportation of those goods need to be under very specific protocol and safety measures, and veterinarians are, you know, for example, like temperature, veterinarians are involved in developing some of that policy as well. Also, animals are a sign of our environment. Let's take raptors, for example, or birds of prey. Their wellness is an indicator of how healthy or unhealthy of our environment is. Some of you may have heard of something called DDT, for example, which was a chemical that was used in agriculture production, and it got into our waterways and contaminated fish, which were consumed by raptors. The raptors became sick and ill, and their eggshells became very thin, and their population started to dwindle until we realized that this is a toxic chemical and needs to be removed from production, and that there increased the amount of raptors that were able to rebound and recover from this. So broad profession, they work in a variety of different settings. Clinical practice, we are oftentimes most familiar with the veterinarian down the street who treats our dogs and cats, but they also work in animal agriculture areas, they work in research, they work in government, they work in zoos and wildlife areas, they work in the military, many different career opportunities. The Doctor of Veterinary Medicine degree program, or the DVM program, is our degree at the College of Veterinary Medicine, where students become, again, licensed to work as a veterinarian. It's a 4-year program. They attend classes, you know, Monday through Friday, 8 a.m. to 5 p.m. For about 4 years. They've got some summers off in there, but it's a big commitment in terms of their education. We are running just a little bit short on time, and I want to make sure that Sid has some time to talk here. So I won't get in too much about the admissions process and the you know, nuances of that, but you can certainly venture out to our website and learn more about Vet Camp, which is a career exploration program. We have information sessions that go each month, a recorded information session that you can find on our website. We have tours and all sorts of other great ways to connect with us. So I'm going to turn it over to Sid, who's going to share a little bit about her experience as a student.
Hello, everyone. My name is Sid Weingarten. I originally am from Columbus, Ohio, and I went to undergrad up at a small school in Cleveland, Ohio, where I played basketball, and then I had a biology and chemistry major. The reason that I decided that I wanted to go to vet school, I kind of knew from a young age that I wanted to work with animals. For a while, I thought I wanted to be some sort of horse trainer because I grew up working with the SPCA. I did 4-H, where I showed a variety of different animals, but I always had a love for science and helping people as well. And when I was in high school, I had a horse that had an injury, and I got to go through the process of working with the vet to help heal that. And I realized that veterinary medicine allowed me to combine kind of all of the things that I was passionate about, from animals to helping people to science. And it also was going to give me that different schedule every day of the job that I was looking for in the career that I eventually wanted to pursue. My path to get to Minnesota was fantastic, and it's been the same since being here. I have loved being a part of the CVM here. The people are amazing. I love the coursework that I'm doing. I've gotten a lot of hands-on stuff as just completing my first year. So I still have 3 more years to go, and I look forward to continuing to get to work with all of the people, both in my cohort and then the people within the program outside of my cohort. Yeah.
Thank you, Sid. All right, so I will turn this back to Laura.
Thank you, everybody. This has been such a wonderful time to hear from not only the admissions representatives, but the student perspectives have been so valuable. I've worked in the Pre-Health Student Resource Center for a long time, but hearing from these students, I learned new things about the different professions. So that was really fun. We just want to hit on a couple key points here at the very end, and then we may be able to cover a few of the great questions that were asked and answered in the Q&A, but maybe talk a little bit about them. We wanted to mention that this is a great snapshot of the health degree programs, and the programs we heard from tonight are more commonly considered health professional degree programs. But there are a lot of different health-related degree programs at the University of Minnesota at the undergraduate, graduate, and professional level. So just a few others here on our Pre-Health Student Resource Center page. We have, you can see the QR code down there at the bottom that has a list of the different programs that links out to all of these websites and gives you a little bit of a flavor of who those professionals are, where they work, and in addition to all that great information that we heard today. So just wanted to say there are many different ways to go and find yourself interested in working in the field of health careers. And hopefully you heard a little bit tonight that maybe sparked your interest in one direction or another. And know a few steps that you can take to gain experience and explore those more. One thing that we just wanted to mention is that, so if you are a high school student, there are many ways to stay connected to the University of Minnesota. We will send out the slides for this presentation. And so you saw there were a lot of links throughout. Maybe you jotted some down or clicked on the QR codes, but we'll make sure we get the slides out so you're able to connect with all of those links and go directly to many of the pages that were mentioned there. The Office of Undergraduate Admissions through the University of Minnesota has different ways to come and tour campus. So coming to do a general tour campus, see if the University of Minnesota is a place that you're interested in for your undergraduate career. And then in the fall semester, there will be some options to pair a campus tour experience with a health careers exploration, where you'll learn from somebody in the Pre-Health Student Resource Center about some of these programs, some other of the resources that we provide, and just what it's like to be a pre-health student at the U of M. So those dates will be online on the admissions website beginning in early August. And then again, just wanted to remind you that if you do end up coming to the University of Minnesota for your undergraduate, to start that undergraduate career, our office, the Pre-Health Student Resource Center, is here to be a key support for you. There's so many wonderful places and people to connect with on campus. And we just want you to know that that's what our office is here for, is to support students who are on that road to a health profession, to help you connect with all of the folks that you heard here. So again, a few links that I highlighted here, and in addition to this health sciences gold sheet. So many different ways to connect back into the websites for the programs that we heard about tonight. Now, I think there were a few questions that came through in the chat that were, again, many of them asked and answered, and some of them we'll try to expand on and send some links out when we send that chat out. But I think there were a few different questions that related to this issue of what types of experiences are beneficial for me in building my portfolio as a pre-dental or a pre-med student. So I know there were some great answers in there, but I know if Needy or anyone else, I messaged Needy about some of those questions coming into her. But if anyone else is there that would like to give a brief answer to kind of that experiences question, I think it'd be great to be able to speak to that a little bit in addition to what we've included in the Q&A.
Well, I'll just,
go
sorry.
ahead. Go ahead, Needy.
I'm just going to speak from the perspective of the medical school in the application process and interviewing. When, the medical school does a holistic review. So we're not looking at any one thing. So everybody says, so is scribing better than shadowing, or is clinical experience more? We look at it all. When you see your AMCAS application, there's, I think, about 15 or 18 places on there where you can list experiences. So we're looking at leadership, we're looking at clinical experience, non-clinical, volunteer, shadowing, scribing, along with your MCAT in your score in your GPA. So I think the question was how to start to build that. And as a high school student, you can start to see where there's opportunities in your community where you can show that leadership or do some of that experience. Somebody said, is an EMT better than a nursing assistant? No, when we look at it, we're looking at it as, again, a holistic review, looking at a diversity of experiences and also in a diversity of community populations that you're working with. So I will let Mark or even Bailey talk more about that as well.
Yeah, Needy. I was just gonna say, back when I was in high school, I'm sure when Claire was in high school, there was a rush to try and fill the resume, fill an application with lots of different experiences. What we're gonna look for, especially when it comes to that holistic review, is we want to know what you're passionate about. Your passion will come through in a written response. Your passion will come through if you interview, whether that's in person or asynchronously. Do things that you're passionate about. And that's one of the typical markers really of your generation, is that you don't waste time doing stuff you don't care about. You just do stuff that you love, that you're passionate about. And so I would say you're in a great spot to lean into that. Find things that you really want to do, find things that you're really passionate about, and dive into those, because that's really going to, that's what's going to set you apart, because everybody's rushing to be a club president. Everyone's rushing to do Feed My Starving Children and to do research and all those other things, but we want to know what you're passionate about.
Yeah, and I guess
we can see that in your application as well. We don't want to know just numbers and what you did. We want to know what's the experience? How did it make you feel? How did it change you as an individual? What was the impact? Bailey?
Yeah, sorry for interrupting there. I guess my 2 cents as a student who recently went through the application cycle, and something that I try to tell my friends as they're going through, is kind of building off of what both Needy and Mark have said, is that show what you're passionate about and don't try to do every single thing under the sun. If you don't like research, you can tell when you talk to somebody about it. So don't spend a lot of time doing something that you hate. Find those couple things that you really enjoy and stick with it, because I think also having like a commitment to one thing, like if you have one thing that you can stick with for 3 years versus 5 things that you only do for like a semester, stick with that one thing that you're passionate about, because you can really tell, and you can not only show your passion but your commitment. And maybe you tried being both a scribe and an EMT. One's not inherently better than the other, but if you really loved being a scribe and you hated being an EMT, why continue doing the other one when you really enjoy being a scribe? So even if, some people tell you like, oh, this one's better than this one, if you don't like it, don't stick with it. And then also don't try to do every single thing under the sun. Try to pick a couple things that you really enjoy, you're passionate about, and show commitment to that, because I think that also can speak to character. And also just learning for health sciences in general, you need to be committed to it, like any program you're applying to. So finding those things that you can stick with for a long time are just I guess, stuff that I try to tell other people applying and that I think helped myself in my application cycle.
I would just add, if that's all right, I echo everything that's already been said, and that's where oftentimes some of our other programs come into play. A lot of people think, oh, I want to go into medicine, but then after time realize maybe I don't like the blood aspect of it, or I don't love certain aspects of it. And that's what's great about the University of Minnesota system, or our campus specifically, is the academic health center that we all represent or are part of, is that we have such a diversity of opportunities at this one university that you can have easy access to explore the different opportunities within health sciences. And so, one of the main resources being the pre-health Student Resource Center. So a lot of great opportunities there too. So just explore that, and then that will lead you down different paths. And some of the comments that were by some of the other students it was just by people that they talked to that gave them those opportunities or to learn more about that program that went down another route, which then probably again increased their commitment or interest into that program, which comes through then as passion, which then is more likely going to get you into that program, as opposed to I'm just doing the routine because someone told me that I needed to go down this route type of thing.
Well, wonderful. We're just arriving at 8 o'clock here. So at the end of our webinar, we want to thank you so much for joining us and for sticking with us on this evening. Hopefully no one gets caught in too bad of a storm as the next wave of it comes through. Again, we'll send the slides out. We're so thankful for your time, and thank you so much to all of our panelists, our staff representatives and student representatives. It was so great hearing from you, and thank you everyone for taking the time to be here tonight.
Thank you.